Hello everyone. In this video, we are going to learn about preconception care. I am Esru Kesia working as a tutor in Tribhuvan College of Nursing. Objectives: we are going to learn about the introduction of preconception care, definition, aims of preconception care, importance, components of preconception care, steps to improve health before pregnancy for men and women, and also the preconception advice for men. Okay. Introduction. Preconception care is a positive step toward enhancing pregnancy outcome and provide prospective patient, a parent with the option that may not be available once pregnancy is confirmed. Okay, so it is the advice given before pregnancy. Okay, this preparation ideally should occur at least 4 months prior to trying to fall pregnant. If this is not possible, try at least 1 month preparation. Preconception care improves the chance of falling pregnant more easily, having a healthy pregnancy and healthy baby, and aiding recovery after the birth. So, when a couple is seen and counseled about pregnancy and its course, the outcome, well before the time of actual conception, then it is called preconceptional counseling. Definition: maximizing the gains for maternal and child health. So it improves the health. So it safeguards the health for both the mother and the baby. Okay. Preconception. The aim of the preconception care is to save as well as improve the health and gain back the health for both mother and the baby. The action definition: preconception care is the provision of biomedical, behavioral, and social health interventions to women and couples before conception occurs. So, this is about the definition. Aims: improve maternal health and child health status, reducing environmental factors that contribute to poor maternal and child health outcomes, prevention and control diseases, health benefits to the adolescents, women and men, irrespective of their plans to become parents, to secure optimal health and nutritional condition in both parents, not only improves the chances of conception but reduces the possibility of prenatal death and many congenital anomalies. So this is one of the main aim of preconception care, to reduce the death of the mother and the baby, that is perinatal mortality and morbidity. We wanted to reduce it. The other aims: to ensure the woman and her partner are in optimal state of physical and emotional health at the onset of pregnancy, to access normal health by a childbearing woman, while at the same time identifying existing or emerging illness or disease which may have gone undetected before. To develop positive attitude about sexuality, womanhood and childbearing. To benefit women being treated for a condition such as sickle cell anemia, thalassemia, hypertension, heart disease, diabetics, that may cause a high-risk pregnancy. So the main objective is to ensure that a woman enters the pregnancy with an optimal state of health, which would be safe for both herself and the fetus. Because the organogenesis is completed by the first trimester, by the time the woman seen first time in the antenatal clinic, it is often too late to advise, because all the adverse factors have already begun to exert their effects. So preconceptional care is very important to have a healthy baby and a healthy mother. Okay. Importance of preconception care: establish lifestyle behavior to maintain optimum health, identify and treat risk, example medical conditions, substance abuse before, and conceive a pregnancy without necessary risk factors, and prepare people psychologically for pregnancy and the responsibilities to become with the parenthood. Reduce maternal and childhood mortality, uh, infant mortality, it means maternal and infant mortality, and prevent an unwanted pregnancies, prevent complications during pregnancy and delivery, prevent birth defects, and prevent underweight. So virtually this preconceptional care counseling is a part of preventive medicine, because we are preventing all the abnormalities that could possibly occur for a couples, okay, and the baby. Next is components of preconception care. What are the things we are going to concentrate in a woman is nutritional condition, genetic conditions, environmental health, infertility or subfertility, too early, unwanted and rapid successive pregnancies, and sexually transmitted infections and HIV, interpersonal violence, mental health, psychoactive substance use, and tobacco use. So let's see this one by one. First is nutritional condition. Screening for anemia and diabetes, supplementing iron and folic acid, information, education and counseling, monitoring nutritional status, supplementing energy and nutrition dense food, promoting exercise, use of iodized salt, and in tobacco use, screening of women and girls for tobacco use, smoking and smokeless tobacco, providing brief tobacco cessation advice, pharmacotherapy including nicotine replacement therapy if available, and intensive behavioral counseling, screening of non-smokers and advising about harm of secondhand smoke and harmful effects on pregnant women and unborn children. So then, in case of iron and folic acid, we have to give 4 mg of folic acid supplementation per day, starting from the time of conception, and not only from the time of conception, 4 weeks before the conception, prior to conception also we can start this folic acid supplementation, that is 4 mg per day, and up to 12 weeks of pregnancy. Okay, that can reduce the incidence of neural tube defects. So in case of tobacco use, this also should be avoided because it will affect it will cause harmful effects on the fetus. So next we'll see about the genetic conditions and environmental health. In genetic condition, identify the risk factors for genetic conditions, genetic counseling, carrier screening and testing, appropriate treatment of genetic conditions. Inheritable genetic diseases could be managed either by primary prevention, that is eliminating the positive factor, or by secondary prevention, that is terminating the affected fetus. So we can manage, that's how we have to manage the genetic conditions if at all exist. And in environmental health, we have to provide guidance and information on environmental hazards and prevention, protecting from unnecessary radiation exposure in occupational, environmental, and medical settings, avoiding unnecessary pesticide use, providing alternative to pesticides, protecting from lead exposure. So these advices can be given to antenatal women in order to avoid exposure from the environmental. Okay. So in infertility and subfertility, creating awareness and understanding of fertility and infertility and the preventable and unpreventable causes. So we have to educate the couples regarding the preventable and unpreventable causes regarding fertility and infertility. And diffusing stigmatization of infertility. It means reducing the social stigma of infertility. Screening and diagnosis of couples following 6 to 12 months of attempting pregnancy and management of underlying cause of infertility and subfertility. So if at all the couple is trying for 1 month of unprotected sex and they are not able to fall pregnant, it means they have infertility or subfertility. So you have to screen and diagnose the cause of the underlying factors. And counseling should be given for individuals or couples who have been diagnosed with unpreventable cause of infertility and subfertility. So what are the other options they can go is like they can adopt a child or go for a surrogate mother. So the options can be counseled. Okay. And interpersonal violence. Regarding interpersonal violence, what we are going to do is providing age-appropriate or comprehensive sexuality education that addresses gender equality and human rights. And also we can give education regarding women empowerment and recognizing the signs of violence against women. So if at all a woman common reports there is interpersonal violence with her partner, then we can recognizing the signs. Okay, any bruises in her skin, okay, that can be recognized and treated appropriately. And providing healthcare services including post-rape care, referral and psychosocial support to victims of violence, changing social norms regarding drinking, screening and counseling of people, and treating people who have alcohol disorder. Also, if the woman herself is using like alcohol and smoking, means we should urge the woman to stop smoking and taking alcohol, and also abusing drugs. This addicted woman should be given specialized care. So next one is too early pregnancy or unwanted pregnancy or a rapid successive pregnancy. So if these are the case, what we are going to do, what advice we are going to do is providing age appropriate comprehensive sexuality education, providing contraceptives and building community support for preventing early pregnancy, and empowering girls to resist coerced sex. Coerced sex means someone, unwanted sexual activities that happens when you are pressured, tricked, threatened, or forced in a non-physical way. That's called coerced sex. And engaging men and boys to critically assess norms and practices regarding gender-based violence and coerced sex, and educating women and couples about the dangers to the baby and the mother of short birth intervals. So, if the so rapid successive pregnancies occurring, it really affects the health of both mother and the baby. Okay. And next, sexually transmitted infection. So what are we going to do about it? Is what are the interventions for these women? We are going to do is promoting safe sex practices through community level interventions, ensuring increased and easy access to contraceptive devices like condoms and oral contraceptive pills and contraceptive injections. Okay, so we make sure that is available easily in the primary health centers, and screening for sexually transmitted infections and their management. Next is regarding the mental health and psychoactive substances. So first is mental health, assessing psychosocial problems, providing educational and psychosocial counseling before and during pregnancy, counseling, treating and managing depression in women, planning pregnancy and other women of childbearing age. So if there is any pregnancy, you have to identify this, whether the woman is having depression during pregnancy or before pregnancy, and it should be treated accordingly. And strengthening the community networks and promoting women's empowerment. Next is psychoactive substance use, screening for substance use, treating the substance use disorder, including pharmacological and psychological intervention. If the mother is having substance use disorder, we have to, if necessary, we have to use both also. Okay, pharmacological and psychological intervention, providing assistance for family with the substance use disorder, and establishing prevention program to reduce the substance use in adolescents. Next is steps to improve health before pregnancy. Eat a well-balanced diet, maintain healthy weight, drink plenty of water, take nutritional supplements, mainly the iron and folic acid, which I told already, that is 4 milligrams per day, even before getting falling into pregnancy, and up to 12 weeks of pregnancy, she has to take 4 milligrams of folic acid per day to prevent all the neurotube defects in the infants, and take nutritional supplements, quit or cut down smoking and cigarettes, avoid caffeine, avoid alcohol, avoid medication abuse. If at all she is taking any regular medications, if this is a known case, like for example, an anticonvulsant drug or checked, should be checked. If she is taking warfarin, it should be replaced with heparin, and if the mother is taking oral anti-diabetic drugs, then it should be replaced with insulin. So this medication should be checked, and regular routine exercise. Make sure to wear cool, comfortable clothing. Preconception advice for men. So what are the advice we are going to give to men? Stop smoking, use mobile phones only when you're, so the screen time should be reduced. Okay? Avoid increased temperature around genitals, cut back on caffeine, avoid medicines that impair fertility, and follow a relaxing schedule, stops consuming alcohol and steroids, maintain a healthy weight, plan for finances, and think about parenting. So this is about the advices that we are going to give for men. So in this woman, in this PPT, I hope you have gained some knowledge regarding the preconception care. We have seen about the introduction, definition, aims of preconception care, importance, components of preconception cares. The components are mainly nutritional conditions, genetic, environmental, infertility and subfertility, too early unwanted and rapid successive pregnancy, sexually transmitted infections and HIV, interpersonal violence, mental health, psychoactive substances use and tobacco use. So these are the things we saw in the components of preconception care. Then we saw the steps to improve health before pregnancy and the preconception advice for men. So this is about the preconception care. We are going to give counseling regarding the preconception care for a woman and the couples. Thank you all.